my name is Ridha, and my literature review is on the federal regulation of in vitro fertilization. 1 in 8 couples suffer from infertility, which can be defined by the absence of conception after at least 1 year of regular unprotected intercourse. Infertility is much more common than many people may think, and for most couples who suffer from infertility, their main alternative to natural conception is IVF, or in vitro fertilization, which is the union of an egg and a sperm in a lab, which is then placed in the uterus of the carrier. Infertility rates are on the rise, and because of that, this topic is incredibly relevant and should be researched further, which is why I decided to talk about it in my literature review. The goal of my review was to discuss the pros and cons of the federal regulation of IVF in 3 key areas. The first one being federally funded grants for IVF research, the second one being legally restricted medical protocol, and the last one was nationwide insurance coverage for infertility treatments. To collect my information, I began by using a database called Facts on Files, and I recognize that IVF is a very complex and broad topic. So in order to narrow down my searches, I tried finding topics that were relevant to my 3 key areas I was trying to research. Some of the key words that I used were Edwards and Septo, who are the creators of this procedure, Nadia Suleiman, who I will be talking about later in my presentation, and IVF insurance coverage. A critical analysis of the literature found the following. Legal regulation of IVF could potentially allow for increased funding in regards to IVF research. Edwards and Septo, who I mentioned earlier, were only able to finish and complete their research because of a private grant given to them by the Rockefeller and Ford Foundation. Now, this was a private grant, and with private grants comes the chance that there might have been bias in their research because you're trying to please the companies that provided the grants for you. With a federally funded grant, this would not be an issue, and we could hope that the research would be as unbiased as possible. The main opponent to this theory and idea is that the 1996 Dickey Amendment prevents this from happening, as it forbids federal funding going towards the research that involves the destruction of embryos. However, it is important to mention that even though IVF research may include the destruction of a few embryos, it will provide scientists with information and knowledge to treat and aid this procedure going forward. The second thing I found was that federal regulation of IVF could reduce the chance of having multiple births and other birth complications. By this, I mean IVF is a great procedure. However, it does have an increased risk of giving birth to multiple children at once. A key example of this would be Nadia Suleiman, who's also known as Octomom, because she gave birth to octuplets as a result of her doctor implanting 12 embryos in her at a time. There's only a recommended limit as of right now of 2 embryos, but nothing is legally restricted, and having a federally regulated limit of embryos could prevent this from happening in the future. However, the main argument against this is that it would destroy the reproductive autonomy for the mother. By this, I mean that people argue this targets a woman's right to privacy, and that she should be able to decide whether or not she wants a certain amount of embryos implanted inside her. The last factor I wanted to talk about was that federal regulation of IVF considerably lessens financial and mental burden on infertile couples. As of right now, only 17 out of 50 states require some sort of health insurance coverage for infertility treatment. Now, that is because it's up to the state governments and not the federal government to decide these policies. The Affordable Care Act is the reason behind this. The Affordable Care Act does not cover or speak about infertility treatments at all. Any woman who's planning on getting pregnant is recommended to have health insurance, but for many, they just simply can't afford it. So it would be nice, but however, it is unfortunately not feasible to add infertility treatments onto many health insurance policies because of the ACA being highly controversial as is. So adding IVF on top of the IVF insurance coverage on top of the ACA would be incredibly difficult to do in the long run. So after analyzing almost 15 pieces of literature, I found that even though federal regulation of IVF could potentially benefit many, many women, it would be incredibly difficult to do and follow through with. That is because the world of health policy is incredibly multifaceted, and in order to create a legislative change making IVF federally regulated, we must further research the benefits of this idea. In order to have more research be done and the pros and cons more balanced and analyzed, that is the only way that we could proceed with progress in this field and idea. So even though there are many risks and benefits to federally regulated IVF, it really means that we need to continue and do further research on this topic and truly see whether or not the pros outweigh the cons. Even though it would not be an easy endeavor, in the long run, it may benefit many, many people because infertility rates are on the rise. Thank you so much.